Men aged 30 to 44 years and persons with low body mass index have been identified as the most susceptible to drug-resistant tuberculosis.
Studies have found that males have a lower immune response. Like we go to bars, you find more males. When it comes to smoking also, we find more males. So those are some of the risk factors associated with TB.
Kenya's capital has been flagged as a high-risk region for drug-resistant tuberculosis. Seeing as transmission of TB is airborne, risk of many contracting and unknowingly living with DRTB is high.
Kenya as a country, we diagnosed 961 cases in 2020. That is up 40% from 2019. That Nairobi actually had the highest burden of DRTB, where we diagnosed 120 cases.
Center for Disease Control says drug-resistant TB is more common in people who do not take their TB drugs regularly. Do not take all their TB drugs, those who develop TB disease again after being treated for TB disease in the past, and those who have spent time with someone known to have drug-resistant TB disease.
By 2035, we should have at least 95% reduction of TB and a zero transmission.
About 2,700 health facilities have tuberculosis diagnosis capacity in Kenya, but even so, 40% of TB cases go undetected, and factors such as misdiagnosis come into play.
For a patient to be properly enrolled in a TB clinic, he or she requires around 40 days. So we need a technique that will identify NTMs, maintaining shortest turnaround time.
To avoid getting the drug resistance level, TB patients have been advised to heed to their medication, and health workers should work towards early diagnosis. Ben Kerera, K24, Nairobi.